morning, good afternoon, good evening, everybody. This is in our 2021 webinar series. Again, my name is Kyle King. I've seen quite a few names that we have had in the past, and so welcome back if you've joined us on previous webinars. And if you're new, welcome to our 2021 webinar series itself. And so I'm just going to take a few minutes to kind of go through the administrative remarks as we have started this webinar, and then I'll hand it over to Harold. I'm joined by Harold Drager, the president of the National Emergency Management Society, and also Professor Menon from India. And what we will do is then hand it over to Harold for a few minutes, and then we'll hand it over to Professor Menon as we start our discussion on international models in emergency management. Again, this is our focus of our 2021 series, and we're really wanting to explore all the various models that are out there that we can also learn from as we see the different national disaster management models, disaster risk reduction efforts and aspects, and also what other nations are doing. And so we can possibly learn from their experiences, share ideas, share concepts, and build a community about what many of us are working on in our own professions. Now, before we get started, I just wanted to go through a few quick administrative points. First of all, we've had a great turnout for this webinar so far, and we actually have 34 nations that have registered for this event. And so that's our highest number yet. So we're reaching new records every day. So if you have any questions or anything else like that, what's the best thing to do is to go ahead and use that Q&A feature, because we also have Victoria here working with us behind the scenes from Capacity Building International, and she'll be documenting those questions as we come up into the Q&A session, and we'll get those all in the queue and answered as fast as we can. Of course, go ahead and let us know where you are when you're coming into the room and you're coming into the chat. Go ahead and just let us know where you're from, and it'd be great to see that. All right, and so as a quick way of just introduction, so again, my name is Kyle King. I'm the Managing Director of Capacity International and partner with Harold Drager from the International Emergency Management Society on this 2021 webinar series. Harold, do you want to go ahead and just introduce yourself?
I'm Harold Drager, President of the International Emergency Management Society, and I live in Oslo. We are registered in Brussels, but I operate from Oslo.
But because I just wanted to cover a few quick points really quick, which is we have the LinkedIn event up. And so what many times with these webinars, one of the challenges that we had throughout this entire series was the fact that, it's so difficult to plan in advance for all these different webinars and really get the times with the guest speakers and everything. And so what we ended up doing is creating a LinkedIn event. So you can go over to LinkedIn, you can look at it through Capacity Building International, and you can just attend that event. And what we do is we post there, and that will actually notify you or give you notification, as you can see on the right-hand corner there, about when we update that page with new information. So every time new webinars are posted, or if you have questions, or when we put additional documents inside of that LinkedIn event, you'll be able to see it there. So go ahead and head over there. If you haven't done so already, join the 160 plus other people that are in the event, and then you can go ahead and get updates there as well. Future webinars, though, are really coming up, and they're going to be quite interesting. This is actually the first webinar where we start exploring national models. And then we're going to really, the next 2 and 3 are actually going to be with Czech Republic, China, and then Finland. And we have other nations that are also lined up to present their various models as well, from Australia, United Kingdom, Kosovo, Germany, Italy, France. And that list continues to grow. If you don't see your name on that list, or if you would like to present, you can go ahead and just let us know, shoot us an email or a message, and we'd be happy to entertain having your nation present your national disaster management model. That'd be absolutely fantastic. Now, because we are an international audience, because we do have 34 countries that are represented in these various webinars, time zones are an issue. And so you will see throughout this 2021 series that time zones will change when we present. So we're an hour earlier than our traditional time, because we want to accommodate our guest speakers. And when we move closer towards China and Australia and things like that, then those will be earlier in the day, for example, than for the United States and our colleagues in the US. But you can still register, and you can still get a recording. And eventually those recordings will be actually posted and uploaded to YouTube. And you'll be able to see the playlist, the entire playlist that'll be on the CBI website and things like that. So you can see all of the recordings in one place. Now, at this point, what I'll do is I will hand it over to Harold for a quick presentation before we get started, and then I'll over to Professor Menon after that.
Okay, I would like to say hello to everybody. And as Kyle said, we have a new record today with 34 countries. So very happy with this. When Kyle contacted me after our conference last year and asked if we should do this together, very happy how this turns out. But I would like you, maybe most of you know Teams, but I would go through some small things so remind you of what we are. And we are going to have our annual conference this year in Paris. That's why this opening picture. Last year we did it virtually. I hope that we can do it physically this year. It will be October, November sometime. We haven't really decided, but this time we will do it hybrid. We had many good experience with do it virtually, so I think we try to combine. So I myself, I have had my COVID-19 vaccine, so I hope I can be able to travel at that time. But a little bit about Teams, for those who doesn't know us. I did present Teams International Certification TQC. This is Teams Qualification Certification in International Emergency and Disaster Management, or we only call it TQC. We have decided, because we had some questions from academic students, etc., that doesn't have the experience which we require in TQC. So we have decided to develop this further to what we call TQAC, which is an associate TQC for those which doesn't meet our experience requirements. So you can look at this at the website. This again tells about what CBI and Teams do together. And I'm so happy to see how this developed fast and are doing very well. The next thing Teams do is we also do research project. And the project we are involved in at the moment is called Impetus. It stands for Intelligent Management of Processes, Ethics and Technology for Urban Safety. And it's a Horizon 2020 research and innovation project financed by the European Commission. And this is about smart cities. These are things, if you're a member of Teams, you can and are qualified, you can be invited to participate in Teams research projects. And then why we are able also to recruit members from all over the world doing presentation of their national systems. This shows Teams worldwide chapters. And as you see, we have a chapter in India, and Vinod Menon belongs there. Otherwise, we have 37 chapters all around the world, from Australia all the way in the east to USA in the west. And you can see we have none chapters yet in Southern America. And when you see this are from nations which is not having a chapter, please contact me and we could build up chapter, because this network works very efficiently, and we invite you to join us on this. Another thing I like to point out, Teams is a voluntary organization, so all of us work voluntary for the organization, and we have membership. I put up here a certificate. We have different membership, standard member from transition economy countries, professional certified member, when people have been certified, TQC certified, student member, and institutional members. And we also ask for donors, and you can go to Teams website. This, with more members, with more donors, we are able actually to do more of the work we are doing, like this webinar we do together with Kyle and CBI. So please join us and be part of Teams Efficient Network worldwide.
Okay, Harold, thanks a lot. Yes, definitely. If you are interested in Teams, head over and go to the tiems.info website and check them out, and also join the community. I think that's one of the largest reasons why we're here, is to connect with other professionals in the community, share our knowledge and information, and really build that community of interest. So now at this point in time, I will turn it over to Professor Menon, and we will get started with our presentation on India's disaster management uh, agency and model. Professor, over to you.
Thank you very much, Kyle and Harold, for giving me this opportunity to share some thoughts on the disaster management systems and processes and institutions in India. Just a very brief introduction about myself. I'm one of the founder members of the National Disaster Management Authority, the apex institution for disaster management in India, which was actually constituted in 2005 after the Indian Ocean tsunami. As in many countries, most countries actually went in to establish institutional mechanisms, and India also followed after endorsing the Hyogo Framework for Action 2005 to 2015. And so we have, also the discussions, which are happening, on many aspects of disaster management all over the world in the context of the current COVID situation. So I will actually make a brief presentation on India's disaster management systems, processes, and the challenges we are facing because of COVID. So we are basically trying to look at disaster management, the evolution, and the institutional mechanisms, and the experiences and the current contemporary challenges. So evolution of disaster management in India, the disaster management experiences, and the contemporary challenges. That's what I'm trying to cover in this presentation. We will start with looking at what has been the history of disasters in India, in British India, and then look at major disaster typologies, and look at the post-independent India, that is after 1947, how the disaster management systems actually started evolving over time. And Indian Ocean tsunami of 2004 becomes a watershed event. And then the Disaster Management Act was passed in India in 2005, as in most other countries of the world. We look at the challenges in institutionalizing risk governance, and look at the COVID-19 and the disruptive innovations which are happening, including the vaccination drive and the vaccination campaign which is happening. And also look at the Coalition for Disaster Resilient Infrastructure and improved risk governance initiatives, pioneered by the UN Disaster Risk Reduction Agency based in Geneva, along with the Indian National Disaster Management Authority in New Delhi. So during the British period in India, the disasters were mostly floods and drought, which led to famines. And we know about the Great Bengal Famine of 1769 to 1770, where reportedly a third of the population of India perished. And the other protracted famines in India after the Great Bengal Famine of 1769-70 were the Chalisa famine of 1783, the Doji Bara or the Skull famine of 1790 to 1792, the Northwest Provinces famine of 1838, the Northwest India famine of 1861, the Bengal and Orissa famine of 1866, the Rajputana famine of 1869, the famine of 1899 to 1901, and the Bengal famine of 1943, just during the time just before the World War II. And then we saw the India getting independence in 1947, and then we have the drought years in 1965, 1972, 1979, 1987, and 2002. And this is important because we really look at the way disasters have actually changed, the way in which we look at disaster management itself as a series of processes. So from agriculture, mainly dependent, it was actually during the British period, agriculture ministry and the agriculture institutions were managing and responding to disasters like floods and droughts and famines. But in the post-independent period, actually, we saw the bottom line: anything can happen anytime, anywhere. So I think this is one of the things which we need to understand as disaster management practitioners. And the solution is to prepare for anything, anytime, anywhere, anyhow. And how do we really do that? We have to be prepared for everything. So which means we need to have a dashboard which will be able to tell us what is the socioeconomic and demographic profile of the people who are getting affected, by any disaster which is actually striking without any advance warning. But then there are also disasters which can give us early warning. And so we will come to that also. And with changes and advancements in information technology solutions, the internet, we also know that there are many toolkits available now. We have the big data analytics, robotics, machine learning, deep learning, augmented reality, virtual reality, geoinformatics, blended learning, distance education for capacity building, mobile applications, web-enabled interoperable solutions, UAVs and drones, cloud computing, edge computing, and fog computing. We will go through this and then explain what we mean by these terms. And we could also match indigenous knowledge systems and traditional wisdom with the modern toolkits and skill sets for the 21st century solutions. And so that will also be something which we will be looking at. How do we really look at the traditional wisdom of communities? And if you really look at the multi-hazard risk and vulnerability profile of India, 58.6% of the land is vulnerable to earthquakes of moderate to high intensity. 68% of the cultivable land is vulnerable to drought. 12% of the land is vulnerable to floods and river erosion. 8% of land is vulnerable to cyclones. 5,700 kilometers out of the 7,516 kilometer coastline is vulnerable to cyclones and tsunamis. And these are tropical cyclones. And, in many parts of the world, we will also be seeing hurricanes and tornadoes. And, we will also be seeing some of these, geological and hydrometeorological disasters in different parts of the world. In different types of man-made hazards and transport accidents also happen. And we have several million houses getting damaged annually due to floods, cyclones, landslides, and earthquakes. And human, economic, social, and other losses and disruption of livelihoods, as we have also seen during the COVID, crisis. So these are some of the challenges which we are facing as a country. And India is a very big country, 1.38 billion people. So we have challenges where, we need to also understand the disaster affected communities and how do we really respond to them. So some of the major disasters in India, in 1984, India faced the Union Carbide gas leak of Bhopal. In 1984, the Union Carbide gas leak, which happened, was actually the methyl isocyanate gas leak, which really, paralyzed a large number of people who felt breathlessness. And then, we actually did not know at that time that putting a wet handkerchief could actually neutralize the MIC, the methyl isocyanate. And, we would actually have the H2O, water, neutralizing MIC, the cyanide part of it, so that, people will not actually suffocate and then, and lose their breath. And then, will have problems in terms of, unable to breathe and then, lose, respiratory problems, and which has continued even across decades. The super cyclone of Orissa in 1999, which killed more than 10,000 people, Gujarat earthquake of 2001, the Indian Ocean tsunami of 2004, the Kashmir earthquake of 2005, which had its epicenter in Muzaffarabad in Pakistan, and the Kosi floods in Bihar in 2008. And the Kosi actually, has had floods which used to happen almost recurring annually. But then, this flood actually happened because of a breach in Nepal in the barrage, which actually then led to a sudden outpouring of massive, volumes of water, which started also affecting villages downstream. And the Kashmir floods in 2010, the Sikkim earthquake of 2011, the cyclone Philin in Odisha in 2013, the Uttarakhand flash floods 2013, the Chennai floods in 2015, and finally the COVID-19, which actually is continuing to, have its impact, in many parts of the country. So in terms of the broad disaster typologies, as we all know, we have the geological disasters, and we have hydrometeorological disasters, biological disasters, and chemical, biological, radiological, and nuclear emergencies, technological disasters, and accident-related disasters. So these are broad disaster typologies. And then, you also have man-made disasters, including terrorism, militancy, and, conflict, and many other kinds of man-made disasters. most important geological disasters include earthquakes, landslides, mud flows, sea erosion, debris flows, and dam bursts and dam failures. And hydrometeorological disasters include floods, droughts, cyclones, tornadoes, hurricanes, cloudbursts, snow avalanches, glacier melt, and heat and cold waves. And the biological disasters include epidemics, poultry and livestock diseases. Technological disasters include chemical and industrial disasters, forest fires, oil spill fires, mine flooding, chemical, biological, radiological, and nuclear emergencies. And accident-related disasters include air, road, rail, and other transportation accidents, including boat capsizing in rivers, building collapses, and so on. So we have, bomb blasts, festival-related disasters, and many other accident-related disasters which happen. So in terms of the geological disasters, as I said earlier, 58.6% of the geographical area is prone to high-intensity earthquakes. So we have 739 districts in the country, 36 states and union territories, and we have, out of these 739 districts in the country, we have more than 222 districts which are in Zone 5 and Zone 4, so which actually has a large number of people who are staying in these, earthquake-prone districts. And India has faced 4 high-intensity earthquakes of magnitude exceeding 8 on the Richter scale. First is Shillong, 1897, Shillong in Meghalaya with a magnitude of 8.7. Kangra in Himachal Pradesh, 1905 with 8 on the magnitude. And the Bihar, Nepal, 1934 with magnitude 8.3. And the Assam, Tibet, 1950 with 8.6 magnitude. So which, now we feel that there is a possibility of a mega earthquake which could actually happen in the Hindu Kush Himalayas, which could actually destabilize, lives and livelihoods of people in not only the northeastern parts of India, but also states like Himachal Pradesh, Jammu Kashmir, and also Nepal, and maybe even Bhutan, and could also affect Afghanistan and Pakistan and many other countries in the subcontinent. And during the 90s, India witnessed the Uttarkashi earthquake in 1991, the Latur earthquake of 1993 in Maharashtra, the Jabalpur earthquake of 1997, Chamoli earthquake of 99, followed by the Bhuj earthquake of 2001 in Gujarat, the Andaman and Nicobar earthquake of 2004, and the Jammu Kashmir earthquake of 2005, which is the Muzaffarabad earthquake, which I mentioned, and the Sikkim earthquake of 2011. So these are some of the major earthquakes which have happened in India. And if you really look at the region, we could actually see that India is dotted with several earthquakes of varying magnitudes. You could actually have earthquakes and tremors happening with magnitude less than 3, and these continue to happen in different parts of the country, and also in Nepal, in the northeast India, and in Jammu Kashmir, and also in Pakistan, Afghanistan, and in many parts around the country. And the mega earthquakes which have happened over 8 magnitude are also seen in this map, where based on past trends, we actually looked at some of these and looked at the high risk zones of Zone 4 and Zone 5. But we have also seen earthquakes happening in Zone 3. The Latur earthquake in Maharashtra, the Marathwada earthquake of 1993 actually happened in Zone 3. So we need to also understand that these kind of, multi-hazard challenges would actually need to be addressed in terms of certain preparedness. And we would come to that levels of preparedness and how do we really address that through institutional mechanisms and through policy, prescriptions and guidelines and advisories. We actually now see the different types of disasters. We have cyclones, we have drought, we have floods, and then we have the Building Materials Technology Promotion Council has prepared the vulnerability atlases, mapping the areas where we could actually have these high probability of disasters happening. But when we understand disaster management as a discipline, as a multidisciplinary field, we know that there are phases of disaster management can be seen in a disaster management cycle. we have the upper half, which is a pre-disaster phase. And the pre-disaster phase actually has two P's: preparedness and prevention, also known as mitigation or even disaster risk reduction, DRR. So preparedness and prevention are in the pre-disaster phase. And in the post-disaster phase, we see, the response, rehabilitation, and recovery. The response is the emergency response, which actually starts with the relief, which also looks at damage assessment and also provide the opportunities for helping people. So we have the rehabilitation of people who are affected. It includes reconstruction, temporary construction, putting people in relief camps and so on, and then setting up temporary shelters, and then finally providing reconstruction if damaged houses needs to be reconstructed. And then look at recovery, which is not only physical recovery, also social recovery and economic recovery. Now, one of the most important lessons we have learned is that most countries, which are developed countries and advanced countries, are actually very strong on the preparedness and prevention because they use technology and they use a lot of policy interventions. And so because they're strong on preparedness and prevention in the pre-disaster phase, when a disaster strikes these countries, their response, rehabilitation, and recovery is almost seamless. It's spontaneous and it doesn't really paralyze the economy. It doesn't paralyze, lives and livelihoods of the people. And the economy is not really, paralyzed. And, unfortunately, many countries which have faced disasters have also seen that, their economy is totally ravaged by a disaster. Like, we have seen in Vanuatu in the Pacific, or even in Fiji in 2016, they had the cyclone Winston, the hurricane Winston, which hit Fiji. And after that, from 2016 to 2020, they have had, more than 14 different hurricanes hitting Fiji. And so we realized that, these countries actually, a large part of their national income, the gross domestic product, is actually, devastated when disasters continue to keep happening and striking their geographies. So we need to really strengthen our preparedness and prevention, and that is where early warning systems become important. That's where, the use of technology solutions become important. And so we will look at some of these things which have actually happened and which need to be done over the years. So we have disaster striking, and as I mentioned, after the 2004 Indian Ocean tsunami, the government of India set up the National Disaster Management Authority, and the website is ndma.gov.in. So you can actually look at these documents on the website. The National Disaster Management Authority, Government of India's website is ndma.gov.in. So the disaster management national vision, which is mentioned in the National Policy of Disaster Management, which was passed in 2009, approved by the cabinet and endorsed by the government of India, is to build a safe and disaster resilient India by developing a holistic, proactive, multi-disaster and technology-driven strategy through a culture of prevention, mitigation, preparedness, and effective response. So, this is very important to note that, the culture of prevention, of mitigation, disaster risk reduction, emergency preparedness, and effective response. So this is actually what was envisaged in 2005 in the Disaster Management Act. And, we have been working towards that. The Disaster Management Act 2005 was unanimously passed by both the houses of the parliament and enacted in India. And the NDMA, the National Disaster Management Authority, chaired by the Prime Minister of India, is the apex body for disaster management in India. And we have the state disaster management authorities, SDMAs, chaired by the respective chief ministers of states and lieutenant governors of union territories at the second level. And then we have the district disaster management authorities, which are the DDMAs in the 739 districts, chaired by the respective district collectors and co-chaired by the chairperson of the district panchayats in the third tier. So this is actually the effective ways of delegation and decentralization, which is actually expected to happen. And the National Institute of Disaster Management, NIDM, is the apex training institute for disaster management in India. And India also hosts the SARC Center for Disaster Management, SCDM. the SARC Center for Disaster Management and SARC is the South Asian Association for Regional Cooperation, SARC, and it has its headquarters in Kathmandu in Nepal. And the SARC's Disaster Management Center is located in India. It was in New Delhi, but shifted to Gujarat in Gandhinagar a few years ago. So we have the National Disaster Force Battalions as the first responder force for emergency response in India. I must mention that the National Disaster Response Force, the NDRF, is constituted by enlisting personnel, qualified personnel from the paramilitary forces of India, the CRPF, which is the Central Reserve Police Force, the CISF, which is Central Industrial Police Force, Industrial Security Force, CISF, and then the BSF, which is the Border Security Force. And we have the ITBP, which is the Indo-Tibetan Border Police, and we have many other constituents like the RR, which is the Rashtriya Rifles, and so on, which have contributed 12 battalions. So they are young personnel below the age of 40, and they are deployed for 5 years. They're trained, and they're also trained in nuclear, biological, and radiological emergency response. So they were deployed in 2011 in Japan, when Japan went through the triple disaster, the earthquake, which triggered a tsunami, and then the tsunami triggered a nuclear meltdown in Fukushima, and there was a nuclear emergency. So the international search and rescue teams, which had actually gone to Japan in Fukushima, felt that the nuclear emergency was actually life-threatening, and so many of them decided to leave. But the National Disaster Response Force of India, because they had actually gone there with emergency preparedness for even a nuclear emergency, were able to stay on, continue to provide the relief operations, and and then later return back to India after successfully completing their mission. So we will discuss some of these aspects. Now, in terms of the nodal agencies for management of disasters, we have multiple disaster typologies, as we have seen, and there are different institutions managing them. For floods, it is the Ministry of Water Resources and the Central Water Commission. For cyclones, it is the Indian Meteorological Directorate, IMD, which is a part of the World Meteorological Organization and the World Meteorological Networks. Earthquakes, again, the IMD and the Ministry of Earth Sciences. Epidemics, the Ministry of Health and Family Welfare, which is currently coordinating the COVID response. And chemical disasters, the Ministry of Environment and Forests and Climate Change. And climate change, again, the Ministry of Environment, Forests and Climate Change. And industrial disasters, we have the Ministry of Labor handling that. And droughts, again, the Ministry of Agriculture. Rail accidents, Ministry of Railways. Air accidents, Civil Aviation. Fire, the Ministry of Home. And nuclear incidents, the Department of Atomic Energy. Mine disasters, Department of Mines. And landslides, again, Department of Mines and the GSI, which is the Geological Survey of India. And tsunami, the Ministry of Earth Sciences. And for tsunami, we have the warning system, which has been set up by the INCOIS, which is the Indian National Center for Ocean Information Systems. So in terms of the epidemiology of disasters, we have seen that there is a changing disaster and disease vector ecology. Diseases like dengue, chikungunya, malaria are becoming endemic in different parts of the country. And we have gone through SARS, H5N1, H1N1, HIV/AIDS, and Ebola and Zika, and COVID-19 in the 2020 and now continuing. H1N1 started in Mexico in April 2009. By April 2010, H1N1 cases were actually reported in 214 countries with 17,798 deaths. Now, this is something which is important. I would like to mention this, that this kind of a global pandemic situation actually happened in 2010, 10 years ago. And whatever happened in COVID-19, which is actually now getting seen in 219 countries in the world, we had an early warning signal with H1N1. And then, we need to actually develop the kind of preparedness in terms of testing labs and also the testing kits and, PPEs and biosafety labs and so on. And the certain uncertainty, the high probability of a low probability event, which can happen anytime, anywhere in the country, is something which COVID has actually taught us. And also the fragility of humanity that, now with the international transport, international travel, a disaster can actually cross, geographic boundaries. And we cannot actually restrict it by containing it unless, we are also disciplined. We need to really see that. And reactive relief-centric response has been so far predominant, and the lack of effective coordination among the multiple actors. And as you've seen, there are many institutions and there are many bodies. There are central government agencies, there are state government agencies. And so we find that, the working with the community, with the elected representatives, and the decentralized systems of federal governance, we need to also see that we have the kind of robust systems in place which can actually do the systems thinking. So there is a need for a design thinking, which is needed in all countries in the world. So we need to really look at the increasing complexity of disasters and prepare ourselves appropriately. Now, disasters and vulnerability, the urban slums, which we really see that, this is happening. It's not only happening in mega cities like Mumbai or Delhi or Calcutta or, Bangalore or Chennai. It's happening also in many countries. You can see these urban slums which are happening, and this also becomes, potential epicenters for, sudden outbreaks which happen. So there is a need for strengthening our own preparedness and our own capacities for understanding the early warning signals. The drinking water pipelines and also the sewage lines are all underground, and they're also corroded. And we find that there is a possibility of a sudden outbreak of diseases if there's a leak from the sewage pipeline and the water gets contaminated. The drinking water gets contaminated because of these kind of elements which actually can get into that. And so the water quality becomes important. And so we find that even water quality testing will need to be strengthened. Now, coming to COVID, actually, we really see that, we've had a huge outbreak, which actually almost paralyzed the country's health systems. And, we saw that on the 30th of January, 2020, we saw the first case, which was actually reported because of a student who came in from Wuhan in China to Kerala. And then, we saw that, on the 2nd of February, we saw 2 more cases which are getting reported and so on. And from March, we saw the sudden, growth in terms of the number of cases in March 2020. And on 24th, the Prime Minister of India announced a countrywide lockdown. And on 25th onwards, the country went into a lockdown, and we saw that, there was this massive, travel of people, by foot, by cycles, and by all kinds of means to really reach the villages, because, this is actually going to be an indefinite. And so we had 5 cycles of the lockdown, and, the unlocking also happened over a series of, staggered unlocking. And right now, India is going through the second wave in most parts of the country. And, we are also seeing instances of community transmission. And yesterday, the number of cases in India was more than 53,000. And the peak in September 2020 was about 97,000. And at that time, India was number 2 in the world after US. And it was expected that India was actually going to be continuing to have higher caseloads, daily caseloads every day. But then, this caseload started dropping. But now we find that, there is suddenly the wave is rising, and we are also seeing an increasing number of deaths. Now, there are many ways of non-contact, testing, which needs to be done. And then, we've also tried to strengthen our own testing capacity and the surge capacity in hospitals and also in primary health facilities in the country. And for multi-hazard preparedness, it has to be a state of readiness to deal with a threatening disaster situation or disasters and effects thereof. And preparedness consists of capacity building by conducting training programs, undertaking public awareness campaigns, carrying out mock drills and simulation exercises, establishing village-level task forces, getting the community involved, and establishing early warning systems, preparing disaster management plans, at the district, state, and national level. And so we have a national disaster management plan, which was prepared in 2016. And again, it was updated and revised in 2019, which looks not only at disaster management, it also looks at vulnerability reduction and poverty reduction by addressing sustainable development goals, addressing the climate change impacts, and so on. So we have the National Disaster Management Plan of 2019. Copies are available on the website ndma.gov.in. And preparing the stockpiles of sandbags in flood and cyclone-prone areas, community preparedness, and establishing community multipurpose shelters, identifying buildings for relief camps in high ground, and so on. These are some of the areas. And we have actually seen that the damage caused by disasters has been increasing. And now the damage assessments done by the World Bank, UN, ADB talks about, the average even in a disaster like the floods in Kerala was for $4.8 billion. And in Orissa, the cyclone Fani actually has cost a damage of $2.4 billion and loss worth $11 billion. And the recovery was estimated to be about $4.8 billion. And there is a need for immediate urgency to strengthen preparedness to disasters through better early warning systems and predictable models to provide alerts and early warnings to evacuate people and move them into relief camps away from the way of harm. I think in terms of strengthening emergency preparedness and response, we need to have emergency operations centers at the district headquarters, at the state headquarters, and at the national level. And we need to have heli ambulances for taking people away, and mobile field hospitals, integrated ambulance network, interagency coordination, application of geographic information systems, simulation models and scenarios and worst case scenarios, early warning systems, and community-based disaster preparedness. And these are all efforts which have been going on by involving civil society organizations, academia, and research institutions, and think tanks. In terms of the first responders, we have a fire and emergency services, the police and health officials, the National Disaster Response Force and the State Disaster Response Force, and community responders from the urban local bodies, the resident welfare associations and multi-story departments, civil defense, home guards, Red Cross, the National Social Service in colleges and universities, the National Cadet Corps, the Nehru Yuva Kendra, Scouts and Guides, and civil society organizations, corporate trusts and charitable trusts, and so on. And search and rescue capabilities, the National State Disaster Response Force personnel, Army, Navy, Air Force, and Coast Guards, and crowdsourcing geotagged and date-stamped geoinformatics solutions, and IT-enabled data analytics, big data analytics, machine learning, etc., and scenario analysis and modeling. Now, these are some of the things which we are doing. And in terms of strengthening preparedness and response, we need to have web-enabled dashboards, which can be accessed by general public. And these could be mega portals, which could be accessed by all responders and also by civil society, government agencies, corporate sector, and so on. Improve preparedness through interoperability issues in information sharing and dissemination. This is one of the challenges which we faced during the COVID period. We did not know how many people were affected, how many people needed relief, how many people had to be provided support. And so ultimately, the kind of crowdsourced information support from organizations and networks and civil society groups really help a lot. An emphasis on disaster risk reduction and preparedness and mitigation, capacity building, training, education, research and development, and documentation, public awareness using electronic and print media and non-conventional media, street theater, mobile vans, and exhibitions, regulation and enforcement, strict compliance of advisories, that's very important, and strengthened emergency response through mass casualty management, heli ambulances, mobile field hospitals, and biosafety labs, and involvement of startup companies and incubators for mobile applications, and non-contact thermal scanners, and non-contact digital surveillance and monitoring instrumentation. And these are all efforts which have happened in collaboration with academia and the Indian Institutes of Technology and the National Institutes of Technology and engineering colleges, teaching computer science and electronics and in instrumentation, were providing these kind of solutions. And as I mentioned earlier, the cloud computing and fog computing and edge computing, and these are terms which are used for data capture, and seamless upload to the server when the device is in a Wi-Fi zone. So, in remote areas where, you do not have access to power and so on, if, you're able to capture it on a mobile device, and whenever the mobile device gets into a Wi-Fi zone, it uploads it to a server. And so this technology solution is actually now being attempted by many institutions and, organizations. So I think, we could really look at this as a solution which could actually improve data capture. And hackathons for engineering solutions in a connected world by bringing people from different countries. And the Teams network is an example where we have professionals across large numbers of countries, large number of institutions, and professionals from different disciplines coming together. And networking with global institutions, academic institutions, and professional networks, knowledge management, advocacy, and partnerships. And strengthening the emergency operations network, EOCs, Emergency Operation Centers, and providing the last mile connectivity for dissemination of alert and early warning messages, review of curriculum in professional disciplines to make them contemporaneous, strengthening the fire services and strengthening civil defense and networking of professional, scientific, and technical institutions, mainstreaming disaster management in our planning processes. That's very important. And the role of media in public awareness and disaster preparedness, mitigation and emergency response, structural and non-structural mitigation projects. This is very important. Social engineering becomes extremely important. We need to really build on our social capital, and that is one of the biggest messages from COVID-19. We saw that online education was actually becoming a challenge because of lack of access to internet, lack of access to smartphones and computers and mobile phones and data plans and Wi-Fi, internet, and power even, in many remote parts of the country. So these are some of the challenges which we need to really look at. And disaster management emerging as a mega discipline, which really brings in emergency medicine, search and rescue capabilities, including very sophisticated search and rescue tools. We find that we can even listen to heartbeats from a collapsed structure by using sensors. And so we can really look at that. We can look at even there are ways by which thermal scanners can actually even look at the heat, the ways by which you can actually identify trapped bodies because of images which can actually be found from these kind of scanners. Spatial modeling, scenario analysis, digital forensics, and forensic sciences for DNA and postmortem and those kind of support services, early warning, remote sensing, hazard chemicals, vehicle tracking, especially for radiation or even nuclear waste dumping and those kind of challenges, disaster mitigation, preparedness and response, setting up temporary shelters, multi-hazard resilient construction, floodplain management, gender issues and inclusion, trauma management and psychosocial care, knowledge management solutions, institutional networking, and using GIS for ideal spatial location of public service, public institutions and amenities and basic services, and the use of ICT, information and communication technology. And these are some of the solutions which we need to really bring in as a discipline. Now, I will conclude here. And one of the most important changes which is also happening is, apart from the National Disaster Management Authority, we also have now the Coalition for Disaster Resilient Infrastructure, the CDRI, which recently had an international conference on disaster resilient infrastructure on the 17th, 18th, and 19th of March, which was addressed by the Prime Minister of UK, the Prime Minister of India, the Prime Minister of Italy, and the Prime Minister of Fiji. And a large number of people attended from many countries. Thousands of people participated in that. And if you want to look at that, the proceedings of that conference, you can look at icdri.cdri.world. I will put it in the chat. And the CDRI, the Coalition of Disaster Resilient Information, the details can also be seen on cdri.world. I will also mention that in the chat. The website is cdri.world, and the international conference proceedings are also available on icdri.cdri.world. I want to thank Kyle and Harold for giving me this opportunity to share, some of the impressions. I know that, handling this in 30 minutes or 45 minutes is not really enough to capture the entire gamut of issues. I try to just compress it into a few slides. Thank you very much. I'll be happy to take up questions.
Well, thank you very much. Yes, that is extremely difficult to cover within just a short amount of time, but I do appreciate you trying to do that and giving us a nice overview of some of the challenges that India is facing. Before we jump really into the questions, we have quite a few of them. I wanted to come back to one thing that you said, which I find quite interesting, at least from my perspective, my history as far as working in capacity building with developing and post-conflict nations. You mentioned community wisdom as something that really should be taken into consideration. I think that's one of the things that we have sort of not paid enough attention to, or sort of lost over time. As far as we have advancing and emerging technologies, we continue to strive to be on the cutting edge of implementation of new ideas, but we often overlook the issue of just what is the historical aspect of the community leadership. And as we say in the United States, all disasters are local at the end of the day. What has been your experience in terms of this community wisdom aspect, and how have you worked to try and integrate this more into the disaster planning and disaster risk reduction programs?
Yes, that's a very good question, Kyle. Actually, one of the ways by which we actually saw glimpses of that in different parts of the country has been by looking at tribal communities in Andaman and Nicobar Islands. The tribal chieftains saw the way in which things were happening, and they were also able to see, reportedly, bugs and beetles and rats and bandicoots and all coming out of the holes, and they saw that there was something happening in the nature. And if you're observant enough, you can actually see some of these things. And these tribal chieftains actually saw that this is happening, and they said there is something going to happen, and they said you must go to high ground. And because these are all coastal communities, and so they went into high ground to basically make sure that they were all away from the way of harm, and they were able to save lives in large number of islands which are inhabited. We have about 572 islands in Andaman and Nicobar. Only a few of them are actually inhabited, but in the inhabited islands, actually people were able to save their lives because of this warning by the chieftains to reach to high ground. And we have also seen that among communities which are actually prone to earthquakes. Like you see the cattle, normally the livestock actually has a bell around the neck. You find that. And so some of the houses in Maharashtra, actually in the earthquake prone areas, were actually hanging this bell on the door frame. So when the earthquake was about to happen, this bell started clanging. And so now you actually get some kind of a message that there is something going to happen. This is also from chained animals. They tend to become restless, and they also tend to actually want to escape. So there are many examples from that. And one clear example of understanding this is also from old books, literature, old anthologies and so on, in which epics, you can actually go back to literature and find that there are references to some of these old disasters which have happened, and how it is communicated in poetry and also in literature. Now that there is this girl who actually saw this while she was holidaying in Thailand, Tilly Smith, and she became an ambassador. She was actually acknowledged by the UN ISDR because she was able to raise an alarm when she saw that the water was receding when the tsunami was about to happen. And she saw the water turning turbid and the water receding, and she alerted people who were actually on the beach, and saved apparently thousands of people in Thailand. So if you Google Tilly Smith, and then how she saved people because of what she had learned in her in her classes, that one of the early warning signals is for the water to recede. You see them on the shoreline, you see them on the sands, and you can also see that in Tamil Nadu in India. The women and children saw that there were a lot of fish on the sand when the water receded. On the shallow waters, you could actually see lots of fish, and they went with buckets and baskets to collect this fish. and they didn't realize that the sea had actually gone back because it was going to come like a huge high wave and then take all of them back into the sea. So these are important. The community understanding is very important.
Yes, I completely agree. We've got quite a few questions here, so I'm gonna do my best to sort of combine ones that are somewhat similar. The first one, let's talk about communications a bit. So, preparedness and response plans at community level will be necessary, and how can multi ministries reach communities in effective ways? And could you give possibly an example of, say, the use of digital technology to reach more rural areas, for example?
Yes, actually, in 1999, you know, that was 22 years ago, when we had the super cyclone in Orissa. In some of the remote villages, the message was actually sent on the neck of pigeons, saying that the cyclone is coming, because there was no way of communicating. And now we have all kinds of technology solutions. We have satellite phones, and we have interoperable modems, and we have communication facilities which can actually wireless and Wi-Fi, and then we have VoIP and ROIP and all kinds of solutions. So reaching the last mile is actually always a challenge. How do we really communicate that? And now we know that the whole of sub-Saharan Africa, the number of phone tele density is about 600 million. And in India, we have 880 million telephones available. I think mobile phones are becoming extremely important. And then we can actually send text, you can send voice. You don't even have to understand that, take the trouble to text things. You can even speak and then communicate a message. And this can also be on a broadcast mode, which can go to all mobile services. If the mobile's service operator can actually help you to reach out. So you can actually have these kind of SMS burst messages happening. You can have broadcast messages happening. You can also have radio and FM radios on automobiles. You can actually communicate that. And so you need to really look at multiple solutions, and you need to also have multiple redundancy. If something fails, then you must have backup plans where this can actually continue to be reaching to people. So technology is now making that possible. You can have blogs, you can have messaging which is being done. Now we have Twitter, and we find messages actually happening on Twitter, reaching out to people, and then we are reaching people across the country for getting hospital beds, for getting convalescent plasma from recovered COVID patients who can help save lives, for getting blood for cancer patients, or for getting organ transplant requests from people who need elective surgeries for organ transplants. Now social media is helping a lot. I think we need to really make use of these solutions to reach out to communities, and also using public address systems to go into remote areas, on police control vehicles, control room vehicles which are going, and also ATM cash delivery vans which are going out from banks to all towns and even suburban areas and all that. We need to look at very innovative ways of communicating, by putting a PA system, public address system, on these kind of vans. You can actually send messages, and then can we communicate that to people. So I think technology can actually really provide a lot more solutions.
I think with the advancement of technology, there's often another set of challenges that come with that. And so another question would be, if you could elaborate a bit more on the data and technology sharing initiatives currently pursued by different agencies and institutions in India. The data sharing, data privacy is a hot topic these days, of course, within the United States, and of course European Union with GDPR and everything else. So how is that being shared, or what sort of initiatives are taking place currently with regards to data sharing?
That's right. In fact, actually, this is very interesting. We have this problem that when people started going in for registering for COVID vaccines, you need to put your mobile phone number, you need to put your date of birth or year of birth, and then you need to also give your name, and you need to give your identification proof what is the number, whether it's a voter identification number or any personal identification number like your passport number and things like that. In if you really see the QR code of that, many people started putting this registration and also the vaccination certificate on social media. And if you really see that, we had to then communicate to people that, please don't do this. And you have to smudge some of these things because your QR code actually has a lot of information which can compromise, your privacy, and, which can actually even, affect, cyber frauds, because, your bank details and everything can actually happen, by getting your identification of your income tax, or, your date of birth, and your bank account number and your identification number, and everything is all connected. So I think data privacy is an important area, but it's a double-edged sword. We need to also have some information which we will need to really look at a unique identification of individuals, but at the same time make sure that this is not amenable to frauds. And we have also seen, Kyle, that in some instances, the data of COVID patients were also passed on to insurance companies. And these days, actually, data becomes also a very valuable new oil. It's very cash-rich product. So this can also be misused by people or abused by people. We have to be very careful about that. And I think, we need to bring in checks and balances, and we need to also bring in regulators who will actually be able to monitor this effectively.
Yeah, I agree. It's going to be a continuous challenge. And so a couple of other questions that are sort of more kind of traditional in terms of the DRR platforms and emergency response or NDMA platforms. Let's talk about kind of structures and coordination across all these different structures. So during your presentation, of course, you highlighted a bunch of different structures that are dealing with various different aspects of emergency management, from mitigation, prevention, preparedness, response, recovery, kind of the whole sphere of emergency management. How are these institutions coordinating, and especially in terms of resource management? So could you give us some insights into how all these various institutions are coordinating as far as a decision-making process, especially in terms of national disaster, and then also resource allocation, because, multiple different organizations can, spread resources fairly thin, I guess.
Right. No, this is also something which, we have actually tried to, evolve out of problem solving, because of challenges. Problem solving had to be done because we have something, an institutional mechanism called the National Crisis Management Committee, NCMC. The National Crisis Management Committee is headed by the senior most administrator in the country, the Cabinet Secretary of the Government of India. And then it has the heads of various ministries, like finance and planning, and then we have urban development, and we have the home, and many other very important key ministries, and they are all under the National Crisis Management Committee chairman, the Cabinet Secretary. So that becomes a very important coordination mechanism, so that we can actually look at railways or civil aviation or finance requirements from states where disasters actually happen. And the allocation also happens because, again, we have learned it over time that the National Disaster Response Fund is a kitty available with the Government of India, but we also have allocations which go to the state disaster management authorities by State Disaster Response Fund, SDRF, which is actually provided. State Disaster Response Fund is actually constituted out of the Finance Commission allocations, which are given to the states and to the center. So these allotments are already there, and there is also a provision that whatever comes to the State Disaster Response Fund is distributed to districts for a district disaster response fund. So they also have that. So when a disaster happens, you don't have to keep asking for money, because already there is some funds available with you, and then you can start utilizing that. And when that gets exhausted, you can replenish that by making a request, and there is a central team which will go and observe and then satisfy themselves that there is a need for more funds to be allocated, then they can actually allocate more funds. So we have also another institutional mechanism called the National Executive Committee, which is the NEC headed by the Home Secretary. And the Home Secretary is a Secretary of the Ministry of Home Affairs, which actually then coordinates all the various state governments. The coordination actually happens through the Home Secretary heading this. And so many of the decisions about locking, unlocking, and use of the Disaster Management Act, and also an act which was actually done by the British called the Epidemics Act. And the Epidemics Act is of 1897. You can imagine how long back it was. And the 1897 Epidemics Act was amended, and there is an Epidemics Act Amendment 2020, which actually made that available to the district administration officials to take decisions about, how do we really make sure that, the disease is contained? How do you make sure that somebody who's actually infected is not walking around and then infecting others? How do you really also look at, contact tracing of individuals, who have been infected and their primary contacts and secondary contacts? How can you use technology? All these are actually amendments, which have come in the Epidemics Act 2020 amendment.
Okay, interesting. Thanks.
So these coordination mechanisms are there, and then we understand the need for evolution of new mechanisms. So COVID actually brought in new task forces at the central level, consisting of epidemiologists and data scientists and others who were actually able to suggest, how do you decide who needs to be provided the vaccine? Initially, the decision was that 60 and above should be given the high priority for giving the vaccine. And we found that there were also 88% of the deaths which happened in the COVID in India were people above 45 years of age. So if 88% of the people, and many of them are actually, the single income earner for the family. So which means that, if you lose a person, the only earning member of the family, then, how the family will be able to survive. So a decision was taken, yesterday by the government of India, saying that everybody who's above 45 years could actually then register, and then 1st of April, they will be able to actually access the vaccine, the first dose of the vaccine. Earlier, it was only 60 and above, and people above 45 years who are suffering from comorbidities. Somebody who had, kidney failure and, going through dialysis, or organ transplant patient, and, or somebody with diabetes and or blood pressure, high blood pressure, and so on. They were only allowed. But now they've expanded that 45 and above. But even then, I think one of the challenges which we have found is that for 45 and above, the people in our country, the number, it's going to take 27 months for the people to get vaccinated, which means that it is, more than 2 years for the people above 45 to get vaccinated, to get these 2 doses. So it's a big challenge, because when you have such a large population, this is going to be a problem. And we have been talking about, universal immunization of everybody above 18. And that's, again, probably a double or triple number of the number of people who are actually above 45. So this is, again, a big challenge in terms of, the logistics, supply chain logistics of the vaccine, and also administration of the vaccine. Also the number of centers which are needed. How do we really administer that? And so many issues are there. And also tracking the adverse effect following immunization, AEFI. There have been instances when, we've had people facing, cardiac arrest, or, challenges in terms of, people feeling dizzy and so on. If anybody who's actually above the age of 60, who is actually getting a vaccine shot, there is a fear, and there is also anxiety and so on. There are many factors which are actually responsible, but adverse events happen in vaccine immunization processes. So we need to also keep monitoring that. And now, the different variants of concern are actually showing up. So we also need to monitor that. You saw what's happening in Brazil. You saw what's happening in Italy. So these are all concerns. And we need to also be very careful about how we need to contain this disease outbreak.
Those are all very good points, Professor. I have just a few quick kind of, let's say, technical or kind of systemic questions that I can ask here, and then we can start to wrap this up because we're going well over our time, but it's very interesting. So let's just ask these three kind of quick, I think, specific questions, which are quite good. So the first one being, do we have the channel to connect government or Minister of Office with corporate entities? We know NASCOM plays a role to connect, but they are still also limited to leverage the support to connect with the government. So I'm assuming this is going into public-private partnership in terms of response or mechanisms.
Yes, we have institutional mechanisms for doing that. So we have what is called a corporate social responsibility provision, where 2% of the profit after tax should be plowed back into these kind of public interest solutions, including disaster management and strengthening disaster preparedness and so on. And 2% of profit after tax for large corporate business houses is a very, a very big amount which needs to be deposited for these kind of social efforts. And we also have many companies which have come up with a very innovative venture capital support, or angel investors wanting to set up corpus funds to support the government institutions and also civil society organizations. So we have had trust funds which were set up. We've had many innovative ways of raising funds by people doing crowdfunding solutions and so on. So large amounts have been also collected. So we have an experience of Project Step One, which mobilized 8,000 doctors for telecounseling all over the country. And it was actually an effort of a few individuals who got the support of people who trusted them, because they were able to mobilize 8,000 doctors and also more than 1,000 volunteers. Now they've more than 10,000 people supporting them as all volunteer effort. And they're taking about 30,000 phone calls every day from people. And they've reached out to millions of people in the last 14 months.
Okay, interesting. Now let's talk a little bit, just a real quick question about your National Institute of Disaster Management. And so what are the most important challenges you have had while establishing the National Institute of Disaster Management? So for example, staffing, and how have you overcome those challenges?
Right. So we've had actually over the years, I was a member of a high power committee, which was set up by the government of India in 1999. And one of the areas of doing was to basically looking at the need for capacity building for human resource development, in the field of disaster management. So the government of India had set up disaster management centers in the administrative training institutes of the state governments. So we have 36 states and union territories. And so in these, we have a state administrative training institute for training government officers of all departments. And we have many other institutions like a health training institution. And then we have for animal husbandry, for dairy development, or, even for agriculture, or, for various departments of the government of India. And for state governments, you have training institutions. So we found that training of trainers was necessary. And so we had to have facilities at the state level who could actually bring, trainers from various institutions and also potential trainers. So we were able to do that. And that has been happening over a period of time. And the National Institute of Disaster Management also realized that there is a need for having a separate campus for South India. And so another, branch was set up, in South India because of the need. And then, there are also a lot of other institutions which have emerged. The SARC Center for Disaster Management is there. And then, we have the Disaster Management Institute in Bhopal for chemical disasters. We have many other universities teaching disaster management. So we have also a lot of people getting, identified and then, trained and educated in disaster management from different disciplines. So we have the Tata Institute of Social Sciences and many other universities which have been conducting training education programs, MS in disaster management or MA in disaster management. So there are trained people. And then, we have civil society organizations, NGOs, networks of NGOs, and so on. So we have people with experience, work experience, and also, professional training in civil engineers, architects, psychologists, people with a master in social work, MSW, and many other disciplines, architects, anthropologists, sociologists, psychologists, economists, they're all coming into the field of disaster management, and they contribute their core competencies into that area.
Okay,
So I
thank you
also
for that.
started, I
Yeah.
also started as a faculty member in a state training institute in Maharashtra in the field of disaster management, because Maharashtra had, the earthquake in 1993. We had the Latur earthquake in Maharashtra, and the World Bank and, UN came and said that there is a need for disaster management. We didn't know about disaster management at that time. And so that's how I came into the field of disaster management like that, from a training institute.
Oh, very good. And the last question, and so as a BRICS member, I want to know what type of emergency management system is your country using, such as a incident command system like in the United States? Is it a UK kind of gold, silver, bronze system in terms of crisis management in order to manage a multi-agency stakeholder kind of effort in a disaster?
Yes. So we've had also, the incident command system, the ICS, was actually, studied by India very carefully, because, while we were actually evolving our emergency response systems and also setting up the National Disaster Response Force, we studied this, and we realized that incident command is necessary. A single chain of command is necessary. But then we felt that, the word command is actually seen as an intimidating kind of thing in the Indian context, where we have both elected representatives and also the district officials working with the paramilitary and civil society and so on. So we felt that command is actually a wrong word, and we felt that the ideal word could probably be incident response system. So we have an IRS, incident response system, and on the NDMA website, you can actually see the incident response system which is there, and the district collector and the head of the disaster management authority at the district level designates an incident commander, as a responsible officer. It's called a responsible officer, an RO. So an RO is designated, and then he coordinates this with the district. And at the state level, also there is a responsible officer who's actually overseeing if it's a multi-district disaster and so on. So we have used the ICS, but then with adaptations, in the Indian context, because you have to work with multiple entities and multiple constituencies. So we had to tweak that quite a bit. And then, these details are also available on the NDMA website. You can see the incident response system. If you Google that, I'll be happy to share some of the links in case it is necessary by email to you. And then, you can share that with others in case there is an interest.
Sure, that'd be great. No, that's very good, because I think it's interesting that you of course have to tailor the system to fit your needs of the nation and not necessarily just adopt one model by itself. And so I think that's critically important to be able to make it fit within your systems, your structures, your culture, and everything else that goes along with that. So we have a few other questions, but what we can do is try and answer those, and we'll put those into the event and LinkedIn itself, and we'll put some posts in there. So if you would like to see some of the other questions that have come up during the webinar, please join our event, and you'll be able to see inside of LinkedIn in the event page itself about the additional questions. And so we'll just go ahead and end our session today, because we've gone just a little bit long, but that's completely fine. And I would be remiss without reminding you that, of course, that if you would like to get certified by NATO and the University of California, we have the NATO Crisis Management Disaster Response course that is at the University of California in Irvine, and is delivered in partnership with CBI and the NATO Center of Excellence. You actually get two certificates from the course itself. One is for the Professional Development Certificate for UCI, which is where, if you need those continuing education hours and credits for your AEM or CEM or any other qualification standard, this is a great way to do it. And it is also a NATO certificate recognized by NATO itself. Enrollment is currently open, and we start courses pretty soon. That's actually on March 29th is the actual date there to start the course. Head over to that website there, and we'll also post that inside of the LinkedIn event, and head over there and go ahead and get enrolled if you're interested in attending the course itself. Other than that, I would just like to say thank you very much for attending today, and hopefully you'll join us again in the future for the rest of our webinars we'll be having. And just to say that there will be a webinar about every 2 weeks, so we have quite a few more webinars to go through this year, and we also have some what I call mini series webinars that will be going through as well, and those will focus on COVID recovery and some others as far as data analysis for operational decision making in terms of COVID response. Some really unique kind of specialty webinars that will be coming up starting pretty soon. So watch out for those announcements and via our email and social media channels. And thank you very much, Professor Menon, for your time. And Harold, also, thank you for your time for being here today, and everybody else, and wish you a great day or evening. Yeah.
Thank you very much.
See you.
Thank you. Thank you.
Thank you.
Thank you.
Thanks, everybody.